Okay. Hi, camp followers. How are you? I'm Nicky, and as you can see this evening, we have two fabulous guests. We have Andy and Fergus from Willows Veterinary Referrals in Solihull. And I've seen a couple of comments on our page today about people who obviously know them, maybe have been to see them or worked with them, and really excited and saying how amazing they are. So I watched a Facebook Live that Andy and Fergus did a couple of months ago. I think it was, what was it called? Have I Got Poos for You? Was that right?
Indeed.
Yeah, sound right. And it was really excellent. And I thought they were great. So I thought, we need to get these guys on cam, because there's a lot of chat about dodgy poos and diarrhea issues, gastrointestinal issues, alongside arthritis, especially in our owner group, where dog owners will post questions, ask for advice, post about their experiences with their arthritic dogs, and a lot of these things come up. So I've got together a couple of sort of topics that commonly come up, but if people do have questions as we go through, please do pop them in the comments box, and I will try and keep an eye on these while we're talking, and we'll try and get through as much as we can, because I know this is going to be really, really useful for people. So can I just get you two to kind of give us a brief introduction about why you're so wonderful, and then we'll crack on with some of the topics.
Deathly silence. Who's going first?
You go first.
Fine.
You go first because you're A. Let's go first.
Okay, fine. So Fergus and I both boarded medics, part of the medicine team at Willows, as you said, in Solihull. We're relatively new to Facebook Live, so be gentle with us. I think we did that one that you have watched previously, which went quite well. Yeah. So we're keen to do more and kind of engage with these things, really. We're particularly interested in, I guess, a few different areas, but the gut stuff really comes from our interest in the microbiome. So all these bugs that live within our gut, which are probably key to lots of the diseases that we see within the gut, and probably a lot of the diseases that we see elsewhere. And so it's really our interest in that that's taken us towards an overall interest in gut disease. And there's some other bits around that maybe we can touch on as well, like urinary tract infections and antibiotic use and all of these kind of things. But that's kind of where we come from anyway in the first place.
Yeah.
I think Andy summed that up very well.
Great. And so
antibiotics is a big thing. So that's really my big passion. And I could talk about antibiotic use and misuse for hours. And I think it relates to all the conditions that we see. So I'm particularly interested in the context of diarrhea.
Yeah, there's been well, probably for you guys it's not a massive change, but certainly as a GP vet, I'm noticing that I'm much more aware over the last couple of years of how I'm using antibiotics, especially in those cases, the diarrhea cases. And what you were saying on your live is that actually, well, we'll come to this, but a lot of the time they're not needed. They might accelerate things, but they're not really needed. So I think if we can just start with diarrhea. Why does it happen? What are the common causes? Not just associated with what we're going to mostly talk about, well, not mostly talk about, but things that come up a lot when we're using non-steroidal anti-inflammatories or other drugs for our arthritic dogs. That's one of the questions that comes up. Why do we get diarrhea with those? But what generally are the most common causes for diarrhea in dogs?
Go on, Ferg.
I think it's important, first of all, to make the distinction between acute and chronic diarrhea. So acute diarrhea, particularly in younger dogs, we do look at infectious causes, which can be parasitic, bacterial. We also look at food intolerance and scavenging, and it depends on the habits of the dog. If they will happily pick up a dropped dodgy kebab, then that's an obvious trigger.
Yeah.
And so acute diarrhea is quite a common and often self-limiting problem. While chronic diarrhea, we would be talking mostly about chronic inflammatory disease, chronic enteropathy, also referred to as IBD, inflammatory bowel disease, which can be food responsive. It can relate to dysbiosis. Andy's already mentioned the microbiome, and any disturbance to that delicate balance of both composition and function of those bacteria can precipitate diarrhea and a disturbance there. And ultimately, we also see inflammation that gets largely out of control, a bit like Crohn's disease in people. And that can be a cause of chronic diarrhea that is steroid responsive or immunosuppressive responsive. I think that's that. And then obviously there is cancer causes.
Can you hear, Andy? Can you hear Fergus okay?
Yep.
I think sometimes.
Can you hear each other okay? Because it's just breaking up a little bit. I don't know if it's breaking up for anything else.
I can hear Andy very well.
I can hear Fergus fine.
Okay.
Yeah. So hopefully I'm getting through to some people.
And can you hear me okay?
I can hear you well. But Andy probably knows what I'm saying because I've said it to him 100 times. But so do shout if you want me to repeat anything.
It's fine now.
Okay. I think that's
that's
really
fine. It seems to be coming
the main
clear.
causes. Okay. Do you have anything to add there, Andy?
No, I mean absolutely, and generally, I guess the kind of mechanism of the diarrhea itself.
Obviously, with our
I think we might be losing you, Nicky. Are you waiting? I'll carry on speaking. So the mechanism of the diarrhea itself is usually something that's causing inflammation.
That's fine. You carry on.
Of the gut, be that, as Ferg says, acutely or more chronically, and then that has an impact on the absorption of water, the movement of the gut, and that's the the bit that kind of ultimately causes diarrhea. Yeah.
And so, I mean, in a lot of our arthritic dogs, they are the older type dogs, or at least middle age anyway, and they can be the younger ones. But I guess the diarrhea that comes up quite a lot with the arthritic dogs is more the acute bouts, so the dietary indiscretions and that kind of thing. And then you have got some of them that have those comorbidities of the IBD alongside their arthritis as well. When we talk about diarrhea, I think people can panic about it when their dog gets diarrhea. When do you start to worry about cases of diarrhea? How long would they need to go on for?
So, I mean, I don't think it's just a time thing. Obviously, there's certain things that are going to be really concerning in terms of acute diarrheas, and that's largely around severity of diarrhea. If you go 30 times a day, the consequences of that diarrhea has the potential to be quite significant over a short period of time, i.e., you can get dehydrated. And I suppose dogs who get that severity of disease, they're often going to have vomiting, inappetence, change in appetite and things like that as well. So I think, from acute diarrheas, you can have very severe diarrheas that obviously can be concerning over a short period of time, and those obviously may require some degree of intervention suddenly. Otherwise, for more chronic diarrheas, obviously then they may not be particularly severe in terms of frequency of diarrhea, but then they're things that just keep going on, and the definition most people use of kind of chronic diarrheas is things that have gone on for more than kind of 2 to 3 weeks, that kind of time frame. And then you get the chronic issues associated with that, again, weight loss, poor absorption of food, all of those kind of things.
Blood, I think, is the other thing. So if you've got a hemorrhagic diarrhea, then I would imagine that any owner would be more concerned quickly and will seek attention. And there is this acute hemorrhagic diarrhea syndrome, previously referred to as hemorrhagic gastroenteritis, and that is a condition that can provoke quite serious consequences and merits early intervention, I think.
Because it often won't be the first thing that happens. They would have some diarrhea first in most cases, wouldn't they, before it then developed into hemorrhagic diarrhea?
They can do, but with the AHDS syndrome, it can be quite profuse bloody diarrhea that comes somewhat out of the blue.
Okay, so those are more of a worry. Sorry, I'm just asking somebody to stop using the internet in the house so that I get it to myself. Yeah, so I think it's something, if you're not used to it. So some dogs have recurrent bouts of diarrhea, and owners, I think, are then more used to knowing what they need to do, and how they're going to manage that. But what would you say that, again, the current recommendations for cases of diarrhea, I feel, have changed. So I don't always say the same thing now that I would have said when I first qualified sort of 15, 16 years ago. But what would your advice be for a dog owner who, the dog is otherwise well, has just developed a bit of diarrhea, and the first day of diarrhea, and they're still eating and drinking? What would you recommend?
I love this question, and I think that
who wants to answer that?
I'll try. As part of the Protect Me system, which was our antibiotic initiative to encourage rational use for antibiotics, we produced a non-prescription pad. And I think that there has historically, and I graduated a similar time to you, and when initially that would have been, owners would come in and they would anticipate antibiotics being prescribed early on in the disease course. Now we try and encourage them not to use that, and to maintain bland food to feed through the diarrhea. So historically, I think there was a lot of starve for 24 hours, something like that. But I think that's actually probably negative. And we know this is true for scouring calves. It's true for children with dysentery, that you are much better off feeding through. The gut gets all its nutrition from what you eat. So keep feeding them through that problem, but try and look towards bland diet. Chicken and rice is a staple favorite, but there are alternatives, and ensure good fluid intake and access. And provided your dog is bright, that's all I would do. I would sit tight for 3 to 5 days. Sorry.
Right.
We might have lost Nicky again, I think.
Yes. But what would you do? Would you do anything different?
I mean, the only thing I would add to that is I don't know about changing diet, and I think this is always one of the interesting things around nutrition in acute diarrheas, and actually in dogs that are well with relatively low severity of diarrhea, I sometimes encourage people just to continue feeding the dog's normal diet, assuming that it's a relatively unexciting kind of diet that's being fed, because actually I think sometimes a dietary change, an acute dietary change in dogs and cats does have the potential to cause a gastrointestinal upset. And so whether the right thing to do is change to a bland diet, chicken and rice, I'm not sure. Whether it's better just to continue with the dog's own food, and I'm not sure we have an answer to that really. But probably for me it depends a bit what diet is being fed anyway. Yeah.
Sorry, I'm just moving a bit closer to my router so that I can hear what's going on. Apologies.
Shall we segue into the latest question about nutrition for chronic diarrhea and natural diets versus prescription foods?
Yes,
Andy?
Yes, that would be good. So this is from Sarah. And it says, what about nutrition that is recommended for IBD? Do you consider trying other more natural diets instead of the prescription foods?
So, I mean, diet is absolutely crucial to the patients that we see with chronic gut disease. And actually, if you play around with diet enough, I think the vast majority of dogs with chronic gastrointestinal disease can be improved. The evidence suggests the younger you are, the higher the probability that you're going to be so-called diet responsive. But again, I think a lot of dogs, even the older dogs, if you can play around enough with these things, you will find at least a degree of a positive change. It's still slightly unclear in most of our patients exactly what about particular diets causes them to have disease, and what about those diets allows them to kind of be better. But we tend to refer to them as kind of food allergies, if you like, or it may not be that it's a kind of true allergy in the kind of sense of how those things are usually defined. And so what we try to do to tip the balance in our favor, if you like, is really use diets that are less likely to elicit some kind of immune type response. So that usually means trying to avoid diets that dogs have been exposed to before, so based on their dietary history, so-called novel protein sources, so new protein sources to the dog. And you can do other things.
Protein more than anything, then protein more than
for most dogs, we think that protein is usually the most common culprit. But there are some dogs who probably can react to other things within diet as well. But protein is considered the primary contender. So sometimes we're looking at so-called novel proteins. Sometimes we use this process called hydrolysation, where essentially the proteins are mashed up into tiny little molecules, and so maybe they're less likely to cause an immune response. Or often we combine the two now these days. We use hydrolyzed diets, but ones that are based on novel protein. So I think we use a lot of soya-based diets. These some of the specific diets that are designed for that purpose, and we see good response really with those. There's also interest in whether you can use diet to manipulate other things. We come back again to the microbiome, the bacteria that are there, and there's a little bit of evidence now that we can do things with food to try and encourage a more healthy microbiome. The natural thing is always interesting, and I suppose that plays in a little bit with the kind of raw diet side of things, and I think people are interested in these kind of options from a kind of natural diet point of view. I think home cooking diets can be an option in dogs with gut disease. Ideally, we get those diets formulated by nutritionists. Fergus and I work with an excellent nutritionist at Willows, Izuru.
Yes, we've had him on here before.
Have you? Fine. So there's not many nutritionists around the UK, but if you can get access to a nutritionist and they can formulate a diet, again, those are going to be based on a novel protein source. We pick duck, venison, crocodile, kangaroo, something that weird and wonderful that your dog may not have been exposed to before. But most of those diets that we would suggest would be cooked diets. There are inherent challenges associated with raw feeding, and most of that is around the perceived risk associated with that. There's no doubt that some dogs, you can feed them a raw diet and they can do well on it, but there is increasing evidence that raw diets are associated with potentially negative things. You may have heard about the outbreak of TB, tuberculosis, in cats relatively recently, traced back to raw feeding. There's been outbreaks of infectious gut diseases in people, children, that have been traced back to raw feeding in pets. And so I think for me at the moment, the raw feeding side of things, mostly I think we just have to be worried that the risks involved in those things are probably not worth the potential benefits. And without there being clear evidence that says that these are diets that are beneficial, I think that the risks is a major concern. And so you probably wouldn't find many many specialists who would recommend raw feeding as an intervention. Most of us would say stick with cooked diets, novel protein, be that home prepared, be that commercial novel protein. It probably doesn't make too much of a difference. There are one or two dogs where they don't tolerate as well things like kibble type diets. If they've got a bit of poor movement of their gut, sometimes I think the kibble type diets don't go down as well. But there's in formulations or the home cooked diets that can be really useful in that setting.
Yeah, I mean, it's quite specific, isn't it, from dog to dog? And you can't, I guess it's a little bit of trial and error sometimes, because you don't know what's going to be best for your dog.
It's completely trial and error. And we try and tip the balance in our favor by using these unusual protein sources. But, some dogs will react to soya, and you find something else that they don't react to.
Yeah. I mean, there's a couple of things that I don't know which one to bring up first, really. But first of all, I think the other thing that goes kind of alongside the food and the diet would be the supplements. And, I think one of the big questions that comes up in Holly's Army, our owner group, is if my dog is on lots of medications. So with the medications, sometimes a dog may get diarrhea, and then you think, well, I can't now give that medication, but they can't live without the medication. So I want him back on it. So I might try and change their diet. And I get asked this sometimes as well at work, if my dog is on long-term medication, should I be putting them on something to support the gut? What would you say?
I think you have to be careful with polypharmacy. And I think that we don't understand that as well as we should do. I think that if you start And often older dogs do, especially if they have significant chronic comorbidities, they may be on multiple medications, and they aren't automatically synergistic. Sometimes they will actually counteract the benefits of each other. And so I'm not a fan of just adding further medications in to try and offset problems. And I think often you need to pull back to the really essential medications to manage some of these cases. And we see cases who, through no fault of anyone, they've just accumulated a whole host of different medications that may not work well together. I think that the use of gut supportive medications in particular is prebiotics and probiotics that are of most interest. And I think there's a massive potential here, and we just need to improve our understanding of how these truly affect gut function. So the probiotics that are available, some of them are more suited to human guts than to canine guts, and therefore hopefully there will be more species appropriate products that arrive in the future. We're also not sure as to the right numbers, the right means to administer them. So these are things that we are looking to understand. But I think that there is a lot of hope that probiotics could be tailored to individuals, and we really need to understand what is that particular dog missing, so that we can pick the specific product to rectify that deficiency. And I think prebiotics, which are medications that are designed to feed the bacteria in the gut, I think they're an exciting avenue as well. There is a prescription diet that already has a prebiotic bundle built into it, and I've had a bit of experience using that. I think it's really good and really exciting. So hopefully, if we can combine the two, we might be able to alleviate the need for other more side effect associated medications.
So when you talk about, you're looking at each individual dog, I suppose, and working out what they're missing, would you, that's for the future, that's coming, that's the kind of thing you guys are working on at the moment, isn't it?
In a way.
I mean, I guess, because I know that there's been increased interest, and you're working on doing more of the fecal matter transplants, aren't you? Which, could you just talk to us a little bit about what they are? Because I think it's something that some people, there are some owners that really struggle with gastrointestinal disease, whether it's with or without arthritis, and it becomes very, very stressful. And so if there's anything else that they could ask their vet about or look at doing, they would be interested in it. And I don't think a lot of people know that much about the fecal matter transplants. So would you mind sharing your wisdom, please?
So fecal transplantation is definitely a topic that is, lots of people are talking about now. This goes back hundreds and hundreds of years. You can look at the history of fecal transplantation if you're into these things like we are. In China many years ago, they used to offer people yellow soup, which was a form of fecal transplantation, and was a kind of cure-all. And it kind of disappeared in mainstream medicine for a reasonably long period of time, and then has had this resurgence in the last kind of 10 years or so, initially in human medicine, to treat a very difficult to manage gut disease, so C. difficile, which is this nasty infectious gut disease that people often get. Often it's common in people who've had lots of antibiotics, and so these can be kind of resistant types of infection. And it was something that previously was quite difficult to address in people. And fecal transplantation showed enormous promise in treating that condition, so much so that there's now big, feces banks for people. And if you have seal that's not based in Birmingham, and gets biked around the country in the same way that blood gets biked around by the same teams of people. So it's become very, very popular for treatment of that very difficult condition in people. And as it's become more popular, people have then started to look at that in other conditions. So there's lots of trials on the way also in human medicine looking at its use in chronic gut diseases, so Crohn's disease, ulcerative colitis, and has shown some promise in managing those conditions. And so, of course, the natural progression of that for us is that it's something that we've got interested in, and we've been performing now for quite a few years, actually, in terms of a further method of manipulating the bugs that live within the gut in dogs. Fergus mentioned the fact that actually one of the challenges with probiotics is that, we don't know what the best probiotic is to give. So, what could be better than a probiotic? Well, giving essentially a blend of bacteria that we could never probably replicate in a probiotic. So we take feces from healthy dogs, normal healthy dogs without gut disease that haven't had antibiotics, these kind of things. So hopefully they have what you might call a normal, whatever normal might be, a normal microbiome. And we deliver that into the dog with disease of their gut, or potentially with other diseases as well. And there's a bit of interest with a few other things. And hopefully we take those bugs and it kind of repopulates the recipient dog's gut with the bacteria that we would want it to have. And that those then may be able to exert some of the beneficial effect that some of the bugs within the gut can exert. And all of the bacteria that we have tend to, do different things. They digest things, they produce certain chemicals, etc. And all of those different products can have different activity within the gut. And we hope, therefore, that if we can make the bugs more normal within your gut, that may, have a dampening down effect on your gut disease. And that's really something we're trying to answer a question at the moment. Fecal transplantation for a while has been used as something of a treatment of desperation. We used to use it in the dogs who really have failed everything else. And sometimes we did have some positive responses with that, but ultimately we were using it in dogs who have, really difficult to manage gut disease. What we're interested in now is actually using it earlier on in the disease course. And so the project that we have ongoing at the moment is using fecal transplantation right at the start. The first time we see these dogs, when we know that they've got chronic inflammation of the gut, and alongside some of the other things that we would normally use, such as dietary change, does it improve the signs more quickly? Does it give a more sustained response if we give fecal transplantation as well? So it's a fascinating tool. We really are only just scratching the surface of the diseases that we may want to use it in. Again, as Fergus mentioned, we need to understand a whole lot more about, what kind of bugs are helpful, which bugs benefit from these things, and that's something that we're trying to explore, because I suspect from our experience that there are some dogs who benefit more from these things than others, and those are probably dogs who have a particular derangement or deficiency in their gut bacteria to begin with.
It's exciting times, isn't it? Because so many dogs now have gastrointestinal disease, and I think it seems to be more of a frequent thing, and I think it seems to be more common in people as well. So it's probably just, I don't know, lifestyles and diets and whatever else. I mean, maybe it is because we now have access to more medications and we're giving our dogs more medications. I'm not saying, in some cases it may be that when we get better at something, it has a detrimental effect on something else.
Morgan Spurlock did the Super Size Me experiment. I don't know if you remember that a few years ago, where he went
on Channel 4 or something.
He went and ate McDonald's every day, and he always had to go to McDonald's for every single meal. 3 times a day for a month. And afterwards, and this they don't mention in, I think, his TV show, but afterwards they did fecal analysis on him, and the damage that diet had done was worse than sort of every antibiotic you could have put into him. It really reduced the diversity so dramatically that he had what was considered a very dysbiotic or unhealthy gut microflora. And so I think, and that's you're
just
right.
Within a month.
Just within a month. And so I think we should be careful with what how we're supporting. These are our friends, and we need to support them to maintain our own health. We are hosting the there's as many bacterial cells in us as that we've got cells of ourselves. So
Wow.
we do need to get on together for the whole joint organism, if you like, to be healthy.
Yes, yeah, definitely. I've got a question from Amanda up here about IBD and fecal transplant. So if your dog has a fecal transplant, do they still require all their IBD medication? Or is it very different depending on dog to dog?
That's what we're trying to answer. And I think that is a great question. We hope that it can negate the need. If we can get it right, if we can reestablish or help reestablish a positive flora, then I think there will be less requirement for medications to manage IBD.
Yeah.
So I think it's part of a strategy, and one that hopefully will reduce the need for other medications which are inherently more likely to cause side effects.
Yeah, yeah. So just going back a couple of steps with diarrhea in the first place, one of the questions that comes up a lot is when people start using non-steroidal anti-inflammatories with their arthritic dogs, and it's not just at the beginning, it can be after 6 months, and their dog will develop diarrhea. So if that happens, what is your general advice? Because some of the dogs get on very well. You stop the anti-inflammatory and they go completely back to normal within sort of 48 hours. Others don't. I mean, my biggest question, I suppose, would be when they do go back to normal, do you risk restarting them on their anti-inflammatory? What can you tell us about why we get diarrhea in these cases?
I don't know whether we do the same thing actually with this. So this might be an interesting discussion, because I think there's so little evidence, isn't there, around exactly these things, so that I think these often become things that we've all built up our experiences with time.
Yes.
I think that the challenge for me when it comes to drugs, and probably in some ways now is quite an exciting time for arthritis, because we are starting to get some new drugs and
really
new molecules and things like that maybe change this answer a little bit. But for a long time, I think the difficulty we've had with dogs with arthritis is that actually these non-steroidal anti-inflammatories, they are the most effective drugs at managing kind of chronic arthritic pain, and you can switch them out for other things, but I don't know, in my hands I often find that you're switching them for something that is inferior in many ways. And so I'm often quite keen to try and continue use of non-steroidal where possible. So my approach would be, if you've been on a non-steroidal for a period of time, you develop gastrointestinal disease, yes, if that's a significant disease, we probably have to pause that non-steroidal for a short period of time. But I would give the drug the benefit of the doubt, if you like, and say once that gut disease has subsided, I would try reintroducing it and see if it's tolerated, because ultimately we have no tests to know is that diarrhea non-steroidal related or something else. And so I would always try it again in most situations, unless there'd been some hideous thing that I thought was probably related, like we were worried there was a big kind of stomach ulcer or something like that, where maybe I'd be a bit more reluctant. But for kind of simple, uncomplicated gut disease, I think I would always try and reintroduce it where possible. If you reintroduce it and the signs come back, then yes, I think you have to be concerned that obviously those two things may be related. So sometimes then we can overcome that by switching maybe to a different non-steroidal, and some dogs tolerate one where they haven't tolerated the first one. But certainly there's some dogs that all non-steroidals cause similar problems, and I think they then become more challenging dogs to manage.
Yeah, I think that's quite reassuring though, because a lot of people have got that big question. They don't want to have to go through this again, so it's nice to hear from someone like yourself that you would give them a second chance. That don't always blame the non-steroidal, I suppose.
And I think if you've been on a non-steroidal for 6 months, actually there's a good chance that it may be unrelated to the non-steroidal.
Yeah. Would you agree?
I was just going to say, I do agree with Andy on that. I was just going to say and ask Andy, really, would you use, if you've got this dog then who's had potential gastrointestinal signs secondary to your non-steroidal, when you reintroduce, do you add in that protective medication to try and limit those effects? And because I know some people will do that even preemptively. Is that a good thing or a bad thing? And
Good question.
are you actually creating more problems?
Yeah, I mean, I'm not a huge user of these kind of drugs. Maybe we do the same thing, actually. I think there is interest then in whether we can use other drugs to try and improve the tolerance of non-steroidals, and these are usually antacid type medications or some of the hormone type medications that supposedly can try and negate some of the bad bits of a non-steroidal. I think we have very little evidence to really say that those are helpful things. So I'm not a great user, and actually, antacids is probably another of our shared bugbears. But I think these are often overused drugs as well, and they're not benign drugs. Changing the acidity of the stomach, that also has a big impact on the bugs within your gut as well. And so, these are not completely benign things to use. So no, I don't then reintroduce with something else. I'm not a great user of that, actually.
Okay.
Especially for diarrhea. And I think that the argument when you've got hematemesis, so that you're actually vomiting blood, there is a good case to put that patient on omeprazole, at least transiently. But I think if they're presenting with diarrhea, even if there's blood in it, it's not the treatment of choice, and actually can aggravate that problem. And
would you perhaps consider using a microbiome diet and reintroduce the anti-inflammatory that way?
Yeah, I'm not sure there's any evidence on that front, but it won't hurt. I think I would look at other causes of the diarrhea, and see if you can settle it down. But I wouldn't like Andy. I was leading him
wouldn't reach for anything
in the way
initially.
that I thought he would reply. I wouldn't use those drugs either.
Oh, that's really interesting. So another big topic that comes up is pancreatitis. And a lot of our arthritic dogs either have pre-existing or they develop pancreatitis, bouts of pancreatitis, once they start on their arthritic journey. And one of the big questions that comes up is, can pain that's not managed particularly well cause a flare-up of your pancreatitis?
I don't think so.
Okay.
I don't think so.
Because we acknowledge that we sort of say a lot of time that some of these bouts are stress induced, and so something that comes up a lot is, I'm really worried that my dog has been particularly painful, having a flare up of his arthritis, and now we've got a flare up of the pancreatitis. So is there a link to that? Is it something that we should be putting together? You don't think so?
I think the evidence for that is going to be weak, and we have to accept that we don't know the cause of the vast majority of cases of pancreatitis. So it could be an unknown trigger, but I'm not aware of it being a one that we can readily control or predict. So I would be skeptical of that.
The other thing I think sometimes in this equation is the diagnosis of pancreatitis, and I think that's a huge can of worms in its own right. But it's quite difficult to diagnose sometimes definitively. Some of the blood tests we use probably can become abnormal for other reasons, i.e. if your gut's inflamed. And so I think in some of these dogs, are these bouts of pancreatitis, or again are these bouts of gut inflammation for another reason?
Yeah, because without a lot of further tests, you couldn't really tell which one it is, could you? Bloods alone is not going to answer that question. They look the
same. Ultimately, these things look the same.
Yeah, but if you did have a true case of pancreatitis, what would you? And even so, once they get over, or even a bout of vomiting, would you again be happy? So this is kind of the same question as with the diarrhea. How soon afterwards would you be happy trialing them back on their non-steroidal anti-inflammatory if it was an arthritic dog on that medication? When do you withhold treatment and when do you start it again?
I withhold when they're vomiting, and so I really want them to be not vomiting and eating well on their own. I wouldn't be comfortable reintroducing it before that, but I think with pancreatitis, the recovery can be relatively slow. So I probably would allow them a few days after return of appetite. But if their pain is a life-limiting or debilitating condition, then I think they they need something to control it. And if that's the best option, then I wouldn't be too worried about it in terms of provoking pancreatitis. I think it can aggravate pancreatitis, and you certainly shouldn't be giving dogs with pancreatic signs that medication. But once those signs have resolved, I think I would be more comfortable to start again.
Good. And what about things like if they are on joint supplements? Would you be? So I know there was a question about, because we know that joint supplements have got lots of things in them, but is there anything in there that you would be worried about giving a pancreatic dog? Could they continue with their U-move, for example?
Yeah, I mean, these are actually, I mean, for a long time we've worried about fatty things stimulating the pancreas, and people have tried to give very low fat things to dogs with pancreatitis. Even the evidence around that is a little bit sketchy in terms of whether we really need to massively fat restrict these dogs. But generally, most of the kind of supplements that people are going to use, these are not fats. They usually contain essential fatty acids, essentially. So
but they're not fats.
They're not fats in the same way. They don't stimulate the pancreas, and indeed, some of them have antioxidant type effects, and so they're kind of actually molecules that people have been interested in as potentially positive in some of these diseases as well. So no, I don't have particular concerns around joint supplements with these kind of conditions.
That's good.
The time maybe joint supplements can be problematic in gut disease is if you're using flavored supplements. Maybe you can have dogs then who develop a sensitivity to whatever flavoring may be in those.
Yeah, that's a really good point. It's something that probably gets missed. Yeah. Would you agree, Fergus? Is that the similar thing you would say? Yeah.
Very much. Yeah.
Yeah.
I don't think. I mean, honestly, we don't prescribe many of these joint supplements ourselves anyway.
No.
I think that the evidence base for them is slightly, and therefore I think if you are suspicious that they could be contributing to GI signs, I would withdraw them and at least see if you can demonstrate through provocation trials whether they are causative or not.
Yeah.
If you could reassure yourselves that they're not contributing to any signs, then I think that you can be more confident in using them. And I think they are low risk, but also potentially low benefit, and therefore it
may be worth just not doing it.
Yeah, I'm not sure.
Yeah. And I think, like you were saying earlier, Andy, there are we're getting some really interesting and amazing other alternative therapies. So actually, sometimes we now have other things to turn to rather than rely on the joint supplements or the non-steroidal. So I think everyone is very aware of Librela, and on this group anyway, everyone is very aware of that it's out there. And so I think if you're having problems with your dog with gastrointestinal issues, especially recurrent bouts of something, then you need to have a long chat with your vet about maybe what the best option is long term, rather than keep changing it every few weeks when you're getting a new bout of disease. Can we just talk about other signs of gastrointestinal disease apart from vomiting or diarrhea? What other things should we be looking out for in our dogs to do with, gastrointestinal disease, like stomach disease, that kind of thing?
Am I doing that? Yeah. So, I mean, there's lots of other things that we can see so the most common things in the chronic diarrhea or chronic gut disease patients would be things like change in appetite, weight loss, if you're malabsorbing or maldigesting food, and that can be significant in some dogs. There are other signs then associated with things like nausea, and some nauseas are difficult sometimes to say that again.
Borborygmi.
Yeah, exactly.
Yeah, so borborygmi is, do you want to just explain what that is for people? I love that word. It was one of my favorite words in university.
The noises that your tummy makes when you're hungry, or just those grumbling sounds that often embarrass us when we're trying to stand politely during rounds or at a funeral. So.
Yeah, that's what borborygmi is. It's a fantastic word. Yeah. So that you can sometimes get that without any other symptoms, can't you? But if it's unusual, not normal for your dog, then it's significant, and it might indicate that something's going on.
And it can be associated with abdominal pain. So sometimes dogs with that will manifest cramping, and it can be uncomfortable for certain patients. So I think it's worth being aware of. Worth
noting, definitely. So I mean, that's just because vomiting and diarrhea are the most common things that people jump to, but there will be changes. It doesn't have to be diarrhea, but you can have changes in your stool colour and the consistency, even if it's not properly diarrhea, can't you? And that is also important and things to take note of, I suppose.
Yeah, stool colours definitely can be a concern, particularly bleeding type, so what we call melena, which is usually black tarry feces. This is the stuff that might indicate you're bleeding into the the upper part of your bowel, and that would be particularly concerning if you were on something like a non-steroidal anti-inflammatory, because that could be an early sign that you're getting stomach ulcers, something like that going on. I think there are also, benign changes in your fecal colour that we probably don't get quite so worried about. But anything that would make us worried about bleeding would always be a concern.
Yeah, or a sign. So I'm just going to go through a few of these questions here. First of all, can you put the name of the nutritionist, please? So I can put a link to Willows and Izuru, can't I? They'll suddenly be like, whoa.
You'll be delighted, I'm sure. Delighted.
Mr. Popular. So we've still got some questions about prebiotics and probiotics. How helpful are these? Well, I think we've kind of covered that. It's a big question mark as to there's a future in that, definitely. There was a question about, would you use both of them together? I think, in some situations
there are products that contain symbiotics are probiotics and prebiotics in the same concoction.
Yeah.
And ultimately, probiotics become another trial. In the same way that we trial diet, we may then, in some cases, trial probiotics or prebiotics. It's another, another route that we may explore before we, reach for drug therapies in particular.
Yeah. And it's interesting that we haven't even really mentioned antibiotics, because there's so much more that's more important.
They should come really at the very bottom of the therapeutic trial list, I think.
Yeah, and there will be some cases that require antibiotics, won't there? Or not?
I think they have to be very carefully selected. And there is a recent JSAP paper published, was it beginning of this year or beginning of last year, that advocated for really putting antibiotics after your definitive biopsy technique. Right. Because certainly for chronic diarrhea, I think that the threshold should be a lot higher for using antibiotic, because if you're going to be using these long term, they will have adverse effects on your microbiome, and they will contribute to potentially we're struggling with COVID at the moment, and it's been a massive problem. But some of the predictions for the threat from AMR, antimicrobial resistance, are terrifying, and it could be apocalyptic if we are not careful. And we all have a part to play in that. It is a predictable catastrophe. And I think that it does come down to responsible and prudent use from an owner's perspective and from a vet's perspective. So I'm really anti-antibiotics in the context of chronic diarrhea. In an acute diarrhea, there are really only if the animal is presenting signs of sepsis. So an acutely ill and poorly patient, yes, there is a case. If we think that the infection has gone body wide, then it becomes appropriate. Absent that, I don't see the value in them at all.
Although we see that there are one or two conditions we occasionally diagnose that we specifically treat with antibiotics. And I guess if we've got to that diagnosis, but not just as blanket trials.
And I think it is changing. I don't know what your opinion is. Do you feel like it is changing? Are people taking that responsibility on?
Slowly.
Okay.
There's more to be done.
Yeah. I think it's just so people, they really get stuck in their ways, don't they? And they know that it's worked before, but long term, it's not doing that dog any favors. So it's just yeah, getting the education out there, isn't it, really? Let's have a look at this one from Paula. My IBD dog has been having seizures and has hip dysplasia and spondylitis. My vet wants me to consider meds for the seizures. He's currently getting acupuncture for the arthritis. I'm concerned giving too many medications will make his IBD worse, as he's quite stable at the moment. Any advice?
I think it's very hard, and we have to be careful offering too much advice without full information, because I think that sounds like a very complicated dog with multiple issues, and I think they should follow their local vet's advice. I'm cautious to add too much to that.
Yeah,
I think that seizure behaviour, if it's presenting in an older patient as a new thing, merits some detailed investigation to understand whether that's a problem here or a problem elsewhere in the body that's interacting with the brain. And so answering that requires a bit more detail and understanding of that particular patient. So sorry not to be able to be very helpful on that. But
no, I think that's fine. I think that's fine. I mean, I think it has been helpful, because the advice is that, maybe he is going to require medication, but he needs a bit more of a workup to get to that point, and you've got to work out what's best for him, really, I suppose.
You have to prioritize your problems, don't you? Like, we know lots of dogs have chronic gut disease. Ultimately, seizures are potentially a very serious thing to have, depending on the frequency, severity, all of these kind of things. And so, if your vet is suggesting anti-seizure medication, they're obviously worried enough that those are, potentially, now at the top of the list in terms of the concern. And absolutely, if we give other things, and we've got a patient who's got a chronic history of gut disease, there's a risk we're going to upset other parts. But I think, in dogs who have multiple diseases, we do end up having to prioritize, and I think seizures, they are potentially a concerning thing to see, that often will require some degree of intervention.
We've got a question here about IBD from Sarah. Is it important to diagnose IBD with endoscopy, for example, in order to progress, considering that it may not always be possible to confirm? Yeah, because it's a bit of you rule out a lot of other things, and sometimes you're left with that, would you say?
I mean, ultimately, I think endoscopy goes through these, we talk about endoscopy. Really, endoscopy in our patients is a tool to obtain biopsies from the gut. That's really the only thing that we're using it for. The gross appearance of the gut doesn't help us that much. So endoscopy is a tool to get chunks of tissue. We could get those in other ways, such as having surgery and taking chunks of tissue in that way. But ultimately, it's whether biopsy is a useful thing in the workup of these patients. Ultimately, it can give us some information. Actually, in many patients, the specifics of that information doesn't change a huge amount the way that we treat those conditions. So there are some situations where I think that is not that useful, or certainly not an essential step. There are some patients who have quite severe gut diseases where we get concerned that actually their gut disease could be a manifestation of something more sinister, such as a cancer of the gut. And those things can look very, very similar to inflammation in terms of the way that they initially present. In those dogs, I think biopsy is very helpful, because then we know what we're treating, and there are other ways to address that, pragmatic ways, for example. But ultimately, that's the important differentiation in some of those severe forms. So I don't think biopsy is essential. We will treat dogs without it based on excluding other things. But ultimately, it can give you a bit more information about, particularly excluding some of the sinister diseases.
Yeah. And another one here. This is quite an interesting question there. So Andrea says, would obsessive interest in sticks and grass be indicative of GI issues? No vomiting and feces seem normal, but has recently had anal glands removed due to ongoing issues. So we hear a lot, don't we, about what I do in general practice. My dog's eating grass. What does this mean? What's going on?
I think, again, grass eating is a normal behavior. And it's a natural purgative, and dogs will do that. And I think that it is about knowing your own dog as to whether that is their typical behavior and whether it's at a level that is not too onerous for them. I think if it becomes a frequent problem, or if there's a change in that frequency, then it's probably significant and merits for following up. But if you have a dog, and I have a cat who occasionally eats grass and is sick as a consequence, it doesn't. He's done that since he was very little, and for him it's a normal thing. So I think it is about knowing your own pet as to whether that becomes clinically significant. But we certainly hear it a lot as well, and I think when there has been a change in it, it is clinically significant.
I hope that helps, Andrea. Do you have any tips from Anna here? Can you suggest how to administer medications to dogs with GI issues such as IBD who refuse their meds mixed in with their food? Any tips?
Well, I mean, it depends a little bit on whether your dog would tolerate, administration of medication just directly down their throat. And sometimes that is the easiest way. Obviously, if you're looking at really long-term medication, it's not necessarily what we would ideally want to do, because it'd be nice to get them to take them in a way that they want to take them. But if they won't take them in food, often opening their mouth and chucking it down the back is the best that you can do in the short term. And obviously the challenge we sometimes have in gut diseases is that if you're having to use special diets and things like that, you can't stick these in a nice bit of cheese or chicken or something like that other people might get away with. And so you do end up being a little bit more limited from that point of view. People will get kind of creative with the diets that they're on. So, we have a lot of clients who, if you're on a wet diet, it's not such a problem. You can make little balls of food and still put them in it. But if you're on dry diets, some of them are kind of soakable and you can make a bit of a mash stuff and still try and hide stuff in the middle of them. But, ultimately, if they won't take it with food, you don't really have much choice other than just, sticking it down the back of the throat, unfortunately. The other thing is to have a chat with your vet about whether there's other formulations of the stuff that you're using. We're quite lucky now that increasingly there are either other drugs, or a lot of the drugs that we use, particularly things like steroid medications that we use for gut diseases, we can now get in other compounded formulations like liquid formulations and things. And so some dogs who won't take tablets will then take them in other ways. So like I say, just being creative.
The IFSM have a easy to give award, so you can watch out for that, in that there are certain medications that are either flavored or more easy to administer to pets, and they're trying to encourage pharmaceutical companies to make them more appealing to their true client base,
target audience.
And as Andy said, the veterinary specials companies will often make flavored formulations, and they'll often do that bespoke for you. So if you say I'm on this concoction or cocktail of different drugs, they can mix them together and actually get them in a simplified form to administer. So it's worth
speaking. They can mix them together even.
Some medications, absolutely.
Okay, I didn't know that. Oh, that's really interesting. That would help.
Not that it's a relevant example, but they use rifampicin and azithromycin together. There's a combination product there that's quite popular for TB cats.
No, I didn't know that. You learn something. Well, you learn lots every day, don't you, with being a vet? No, that's really interesting, and I think hopefully this has answered a lot of the questions that come up quite frequently, and the concerns, because it isn't nice when you're stressed that your dog is in pain and you're having to withhold those medications because they just can't tolerate them. But I think what's come out of talking to Andy and Fergus tonight is you've always got to then go back and speak to your vet and just think about what's most important for your dog at that time as well, haven't you? And just think there will be a way. If their pain is more than the GI issue, then you have to concentrate on how you're going to manage that first, I suppose. It's always prioritizing.
I think we're both pretty pragmatic about those things, and ultimately many of these are older patients. They are complex sometimes in their health needs, but pain is the thing that often has the biggest impact on their quality of life. And so I think you need to be keeping that at the forefront of your mind. I said before, I think we're lucky that really over the last few years, some of the new molecules, obviously some of the monoclonal antibodies, but even some of the the drugs that now we have, things like Galliprant, Grapipran.
Yes. Yeah.
I think maybe it's more helpful in some of these dogs if they won't tolerate non-steroidals, or we use a fair bit of paracetamol still in our in our dogs who have gut disease or pancreatic disease, and I think that can be a very effective drug as well. So I think thankfully we have more options than we had a few years ago for managing these trickier dogs.
Yeah. So I think if you're worried about things, then do speak to your vets, and we have really amazing specialists in the UK, and I find, I don't know if this is a more recent thing, or if it was just when I was newly qualified, I was just more worried about phoning up a specialist and asking them a question because I didn't want them to think I was really stupid. And now I think maybe it's age or whatever, I don't really care anymore. So when I speak to people, you're all really helpful. It's really rare that you come across someone that isn't very helpful to you. So if you have got problems and you're worried and your vet doesn't know the answer, they will most of the time be very happy to get in touch with somebody who can help you. And these people at referral centres like Willows, like Andy and Fergus, are always there thankfully to help us.
And there's a brilliant, before I'd worked at Willows, I'd never worked somewhere that also has a specific service that looks at dogs with pain. I think you've had Jacques Ferreira, who leads our kind of chronic pain service, talking to you guys as well. That the interesting thing around Willows is that because we're truly multidisciplinary, I suppose, we have input from lots of people into that. And actually, for me, when I'm managing some of these dogs, having the input from somebody like Jacques, so he's an anaesthetist by training, but he runs our chronic pain clinic alongside other anaesthetists and things like physiotherapists and all of these kind of things. Actually, you can have a much more holistic view to some of these dogs, and I think we can do a much better job with them when we combine all of that expertise than any one of us could probably have done on our own.
Yeah, I think when we were talking to him, I was actually quite surprised because I thought that it would be a lot of vets referring to him. And he said actually a lot of the cases that he sees are within the hospital from other departments, aren't they? And then it's exactly what you've just said. It's everybody working together, and you just get this amazing service that covers whatever your pet needs at that time. So, yeah, it's really, really useful. So I think pain specialists are becoming more of a thing as well at referral centres. I think a lot are following the same pattern as Willows and developing their own departments, aren't they? For that,
it's such a common problem, isn't it, in our pets? And I think it's long overdue having people who specialise a bit more in that. And I say for us, it's vital. We diagnose dogs with things, and we go, with him cap in hand, kind of saying, "What do I do now? Poor arthritic dog that now I've diagnosed this, and I'm going to have to change around all of its pain medication." And having his expertise there is absolutely vital.
Yeah, there's always the help there, and when you think there's nothing more you can do, there probably will be. So do reach out to your vets and get talking to each other and share, really. Well, thank you so much, Andy and Fergus, for joining us. Sorry about my whole technical hitch at the beginning. I don't know. I feel like somebody was on an iPad upstairs or something like that. It's Easter holidays and nobody goes to sleep when they should do. Anyway, thank you so much, everyone, for coming and for your questions. And do keep asking them, and we'll try and answer anything else that comes in. So have a good evening, everyone, and we will see you again soon. Bye.